First, I want to start by thanking all of you, our media partners, for being here today and being here consistently, and just letting you know how much we rely on you to get reliable, actionable messages out to our community. You have a reach we can't even come close to matching, and we rely on you heavily to get the information out to our community that they can take action on, that's accurate and reliable. So thank you for that. I also want to say a word of thanks to our incredible business community here in Knox County for their cooperation with this order, the order that is yesterday. We know how hard it is for them to comply, but we also know that we appreciate their understanding that this hardship now is going to help our community later on to come out of this crisis on the other end. Not healthier, but in better shape than we might have been by doing these things, by taking these really hard actions now and making these really difficult decisions. So we really appreciate their cooperation. On that note, another thing that's happened is that the state is expanding assistance for businesses and families, and we encourage the people who are affected by the changes in business and the COVID-19 situation to visit the state's website and the Knoxville Chamber's website to look at those resources. The details will be contained there. They're really acknowledging the challenges of our business community and our families, really trying to expand access. So I'm really happy to be able to say that. Regarding the non-essential and non-essential distinction, we encourage business owners and anyone else who is curious to use the frequently asked questions on our website, and also go to the CISA. There's a CISA PDF where you can look and see where that's a federal designation for essential services, and it's a long list, and it breaks it down into categories. It's really easy to look at, and look at that and say, do I fall into that category? If I fall into that category, I'm essential. If I don't, I'm not. And also look at the order itself. It lists specifically those things we're asking to close and change what they do in their businesses. So look for those, look at those places. And we've also posted that on our website and social media platforms for everybody to have access. It's important that our community use good judgment after reviewing the guidance and to make decisions that protect the health of their families, employees, and our community. Like I said yesterday, this is really something that the health department's not going to be able to solve, the government's not going to be able to solve, the hospitals aren't going to be able to solve. We as a community will be able to reduce the number of people who get sick and die from COVID-19 here in Knox County by observing these stringent social distancing guidelines. Regarding the overall assessment of testing capacity in Knox County, a constant question, we are continuing to work with our healthcare partners every day to expand testing, as this is one of our chief priorities, and actually, honestly, it's one of their chief priorities as well. We're seeing expansion daily. We actually had a couple of labs come online who aren't reporting through the usual public health channels yet, but they are reporting to us. They know they have to report. They're reporting to us, and we didn't even know that we're testing, so that's good news. We know that expanding is happening. Securing PPE, personal protective equipment, and specimen collection supplies continues to be everybody's biggest challenge. And I know you've heard about supplies here and there. Those have not trickled down to the local level yet. We're hopeful that they will, but that takes time. And so that continues to be a really big challenge for all of us. Testing is occurring in many places by local providers, by the hospitals, and more are coming on board every day. We encourage you to call ahead if you feel like you need to be tested for COVID-19. And we also encourage you to only use the hospital if you really have a medical emergency. If you're only mildly ill, the hospital is not the place to go. Call your primary care provider or a walk-in clinic, and they can see you there. Here at the health department, we are collecting specimens in accordance with the Tennessee Department of Health guidelines. Following a phone screening process, folks are brought in and tested by our staff. This increases access for those at higher risk for complications or perhaps folks who might be uninsured. Our current case count, as of this morning, so as of right now, 12:43, We have 13 cases in Knox County. This, as well as additional information on negative tests, will be available on our website this afternoon. After today, this will be updated daily at 11 a.m. So now I'll open the floor to questions.
Dr. Buchanan, can we talk a little bit about, we've gotten some questions in the last 24 hours about the safer at home order, essential, non-essential, you touched on it there. Is there a way that people can report if they think a non-essential business is staying open? Is there an enforcement action that can happen as a result of that?
So basically, like I said yesterday, we are relying on the common sense and goodwill of our community and our business community to make decisions to close their businesses if they're indicated in the non-essential category, to protect the health of our community. The businesses that we have oversight of, we will be able to go and do site visits on them and talk with them and work with them to get in compliance. If somebody has a concern about their company, one thing they can do is reach out to their HR department and talk to them about what they're doing. If they really have a concern, they certainly can let us know, and we'll be keeping a list of those and following up with those as we can. So enforcement is a challenge. Knox County is a big place, and we really are relying on folks to really heed this warning and make changes. Another important thing is that we actually do similar things to this a lot with individuals. It's not usually we also close restaurants, but we have oversight of those. But with individuals who maybe have tuberculosis and you don't want to take their medications, we frequently give them a very stern order or directive to do what we ask them to do. And you know what? Most people comply. And so we're trusting that our community will do the same. Oh, thank you. Sorry. So the question is, I mentioned some things that we have oversight of, and is that hair salons, nail salons? Actually, hair salons and nail salons and some other things have oversight at the state level. So the State Department of Health has oversight of those. We have oversight of restaurants, hotels, swimming pools, tattoo parlors, grocery stores, and some convenience stores. So that's the list of folks that we have oversight of.
So the non-essentials of those tattoo parlors, for example, mm-hmm. That you could more directly.
Absolutely. Other questions?
Dr. Buchanan, this is kind of projecting a little bit, but right now the safer home order is plan A. It could go further. The county has the ability to go further. Can you describe what it would take to get to that point to maybe give some people a break even to say, okay, they may not like what's happening now, but it's not as bad as it could be. Let's hunker down and do what we need to do to get everyone healthy.
So the question is, we have the safer at home order, and there could be more stringent orders later on. And so can you describe what more stringent looks like? So maybe perhaps folks will get on board and follow this less stringent order. If we look at other places where governments at the state and federal level have taken action to enforce a more stringent shelter-in-place order. So shelter-in-place means you don't leave. You stay there. What we're saying is please stay home as much as you can. Everybody, please stay home as much as you can to decrease the risk of illness to yourself, your family, people in the community. And we're asking people to comply with that as opposed to demanding or mandating they comply with that. Those decisions would be made in concert with the local government and the state government. Those are really significant decisions and something we'd really like to avoid. We really want cooperation in our community so that we can stand on this and say, we came together as a community and decided to do the best thing for everybody. And it's hard on all of us, but we're going to do it so that we can reduce risk to improve the health of our community, and also the possibility that we will have a more intact healthcare system at the end of this crisis. COVID-19 is here. It's stressing our community in different ways. It will continue to stress our healthcare system. It will continue to stress our community. So if we have a little stress on both sides. Maybe each side will come out better in the end. That's our hope. We know that social distancing works to reduce disease levels in communities. We've seen that in the past. We've seen that now. So we're hoping folks will comply.
You mentioned we have 13 cases confirmed here in Knox County. Testing, obviously, we know is still ramping up and taking a while. Does that indicate that possibly there are more cases that we're waiting for results back on that we have in our community right now?
I know testing is happening every day. I know my staff is obtaining tests today. Local providers are obtaining tests today. Hospitals are obtaining tests today. So yes, there are people who are being tested waiting to find out the results because people are constantly going and accessing our healthcare system in Knox County and all over the state. So the simple answer is yes, there are people waiting for results. There'll be people waiting for results for weeks. I mean, not waiting for the results for weeks, but that will go on for weeks, and we hope that will expand.
Sometimes the state's website and the health department's website are different in the number of cases that they're reporting. Can you walk us through kind of the way those things get reported and why that might be the case?
Sure. So the state's website is updated every day at 3 p.m. Eastern Time. And so they have the information and they have a cutoff. I don't know what their cutoff time is where they stop counting. So they have their protocol that they're following. Here in Knox County, we have some advantage in that we have providers calling us before that lab report even gets to the state. Providers have a relationship with us. They know it's reportable. They call us and let us know. The state doesn't have that information yet. It takes time for that to get for us to input it into their system. Some labs are reporting to us through different means than through the state. They're coming straight to Knox County Health Department. Again, we would know about that before the state does. We put that in as quickly as we can, but the most important thing, obviously getting the information to the state is important, but for us the most important thing is working with that individual and getting them in isolation, making sure the people that were most at risk around them are protected, and that we do our job in public health to reduce risk of further spread. So data entry to the state might happen after that, but once we know positive, it's getting in touch with that person, making sure that we do our job as public health, reducing risk to the community, and educating the people around them and that person on what they need to do.
Dr. Lee, can we talk about daycares for a moment? They're exempt from the safer at home order. Can you talk about why, first off, and second, there was some language about prioritizing first responders or essential workers. How is that supposed to work?
Well, so again, we're relying on the daycares or child care facilities to make those decisions about need. The idea is that, honestly, if we think about it, child care is an important part of our infrastructure, and it's a really important part of keeping everything going, keeping the lights on, keeping the water running, keeping government running. People have children, and they need to go to work to provide all those services, and they need a way for their children to obtain care. We've worked closely with the child care facilities to provide them guidance on how to safely do that and reduce the risk to the children and the families and their employees as well. They've been a great partner in doing this, and there are also some other volunteer people who are stepping up to help with that. So we're really encouraged by that because we need to keep everybody who can be working. We want them to be working. We want them to be at work for lots of reasons, in part because we want them to have a paycheck and maybe buy a gift certificate to a restaurant or a place that's struggling right now because maybe they had to close or their business is not as brisk as it used to be, or so they can do takeout and support a restaurant whose business is really reduced because all they can do is takeout.
You mentioned some of the specific measures you're working with daycares. Can you give some examples of kind of the safety measures that you take?
Yeah, my staff did that. I've read it. So one of the things I know that they're working on is so keeping children and the caregivers in groups of 10 or smaller and not blending them during the day so that you would, in hopes if you had a case in that one group of people, you'd keep it contained within that one group of people and not spread it through the whole facility. They're not doing any group trips at all. They're not doing any group activities. They're keeping those groups very separate. They're not even eating together. They're eating in those separate groups. They've done away with all their fun, like water things and stuff like that, where people could share germs. They're doing increased cleaning. Again, they're really being very diligent. They really want to take care of those children, and they really want to protect them and their employees.
Dr. Buchanan, back to the case numbers for a second. Of the 13 cases that you are reporting, how many of them are, if you know, how many of them are community spread? And are there any patients being treated in hospitals rather than being in isolation?
As far as how many are community spread, honestly, I don't have that information right at this moment. We know that some people have fully recovered. We do know that some people are being cared for in hospitals because we know that's where the test came from.
And that's in our community,
In Knox County, yes.
and you don't have specific numbers?
I don't right now. I apologize.
We saw the national park system close essentially the Smokies. You talked yesterday about the greenways here in Knox County. This weekend they were packed as people trying to get outside, enjoying nice spring weather, maybe not on a day like today. But do you think there's a point where we would have to consider closing parks and greenways in our area because of the crowds there?
I think what's really important and what to remind people is we want them to get outside and exercise. We will leave the parks open as long as we possibly can because we know that's a way people can get out and get some exercise and, blow off some steam during this very stressful time. What we want to ask people to do, again, we're asking a lot of our community right now, continue to observe social distancing even when you're on the greenway. If that means somebody walks a little ahead or behind, but don't walk in packs of people. Don't go to walk with a bunch of people. Limit the number of people that you walk with. But continue those social distancing guidelines even when you're outside getting some physical activity, and that'll help us all remain healthy.
We've got time for one more question, guys.
You talked about some people in our community who are fully recovered at this point. I guess the question is, we've seen across the country a lot of people coming to the point where they're recovering. Can you talk a little bit about what that percentage might look like, or what age groups those might be, not just in our community, but overall as you guys are planning for coronavirus response?
So what I can say is based on the data, the data in the United States is still kind of new. We're still learning what this disease looks like in the United States. If we look at the data from other countries, in particular China, where we have the most data, about 80% of those cases were mild to moderate cases, not needing any medical care at all. So those folks recover really quickly, and how fast they recover depends on their health when they started, depends on other issues about them themselves, and how well they take care of themselves during that time frame. So there are a lot of variables that go into that, but we do know and anticipate that 80% of mild to moderate disease will persist here in the United States as well.